Good morning, Ma'am Michelle and Miss. My name is John Mark Mojado, then I am a student nurse for today. So today, I'll be performing the Musculoskeletal Assessment. So the purpose for this is to routine physical exam of the musculoskeletal system is to assess the function and screen of the abnormalities. Then compare the bilateral sides, stimultaneously, and expect symmetry and structure and function of the corresponding body area. So for the preparatory phase, so wash hands. So to prevent the spreading of the spread of various like bacteria and viruses. So and wash hands. And alcohol swab. So second, so identify the patient, so to avoid misidentification of information. So then explain the procedure to the patient. So giving informations, make the patient understand and cooperate. So hi ma'am, good morning. How's your day, ma'am?
Okay naman.
So hi ma'am, my name is John Mark Mojado, then I am a student nurse for today. So today ma'am, I'll be assessing yung musculoskeletal strength ma'am. So it's okay to you ma'am, kasi ang mga strength, mga joint ni ma'am, kako ipampalpate ma'am. So I have question here ma'am, so your name ma'am?
Here, Pitas.
Age?
20.
Address?
Dinas.
So okay ma'am, thank you ma'am. So for the performance phase of the upper body, so 4. Inspect the joint on both sides of the jaw and the palpate it. So assess for masses, tenderness, and pain if present. So before I will start, so I would like to wear my gloves. So in order to not transfer the bacteria and viruses. So, hi again, ma'am. So, it's okay to you, ma'am, that I will palpate your jawline, ma'am, or your cheek, ma'am. Okay. So, then ask the patient to open his or her mouth and instruct him or to bite down. So, to assess if there is the presence of pain during massetering. So, ma'am, can you please open your mouth, ma'am, and bite down, ma'am. So thank you, ma'am. So as I observed, during palpating the mandible of the jaw, so I didn't see any presence of tenderness, pain, as well as the masses of the everything is normal. And on the jaw, in the jaw part, and nothing of abnormalities is not is present. So 6, to assess the sternocleidomastoid muscle. Then ask the patient to turn her head from side to side and look up and down. So, ma'am, so can you please look left to the mat, then look to the right, then up, down. So, thank you, ma'am. So, then do the steps again, but with resistance with your hand. So, ma'am, can you please do that again, ma'am? Push, ma'am. Gini, ma'am. Ana. I-push ko na yung all padang rin, ma'am. Hindi kasod, ma'am. Kana, paana, pabanda. Paana, ma'am. So, thank you, ma'am. So, in order to assess the posture and neck movements, then determine a triple movement. Then, associating with the rotation of the head and the side of the opposite, that is contraction and inclination from the side of the contraction and extension. So, as what I observed during the palpation or pushing the head of my patient, so during the assessment, so the sternocleidomastoid rotation is the head is opposite, dead sided. Obliquely, the rotate of the head is and also flexes the neck, and when acting together, it flexes the neck and extends the head. Then when acting alone, it rotates to opposite side, which is the contralaterally, then slightly laterally flexes to the same side, and also acts an accessory muscle of the inspiration. So number 8, so as per the shoulders palpates around the AC, so acro joints, and I see that there is no such presence of abnormalities like masses, tenderness, as well as the pain. So evaluate the elevation of the shoulders, so to determine if the patient has the signs of early scoliosis. So as I observed that, then I instruct the patient. So I noticed that they have the same elevation of the shoulders, and I did not see any signs of scoliosis. So 10, ask the range of motion. Instruct the patient to bring the arms to the side in assessing the abduction and abduction. So to prevent the development of adaptive muscles, shortening, contractions, then shortening of the cups, the ligaments and tendons. So ma'am, can you do it, ma'am? So adduction. So down, ma'am. So thank you, ma'am. So to accomplish the functional activities, so can be viewed in the simplest form of the muscles, the external force, moving bone in various patterns or range of motions, and assess for the pain which is resulting from injuries and degenerative joints disease and arthritis. So as I observed during the abduction of my patient, so as I instruct the patient to do the range motion for abduction angle of 180 degrees and abduction of 90 degrees, then patient normally do the capacity, then range without complaining any pain to see results or finding that the range of motion is normal and no presence of injuries, joint pain, as well as arthritis. So as the client, so to bring the arms up, then the flexion of the flexion and bring the arms up over the head and assessing the flexion above the head. So to determine the cause and severity of the issues you may be having with joint movement. So ma'am, can you please do this, ma'am? Then ma'am. So do it again, ma'am. Above the head, ma'am. So thank you, ma'am. So as I observed, the patient do the 50% and 50 degrees flexion, which is normal for a shoulder raise and positively normal. So no complaints for pain, which lead to abnormalities. So 12, in assessing the internal and external rotation, ask the patient to cross arms and back, inspect the fingers and how close they can get together. So the subscapularis facilitate internal rotation, and infraspinatus and teres minor muscle assess the external rotation. So need for swelling, symmetry muscles, atrophy, scars, ecchymosis, and venous distension should be noted as the abdomen such as rotator, captor, then scrap, suprascapular nerve, then entrapment. So ma'am, can you please, ma'am, do this, ma'am? So ma'am, thank you, ma'am. So thank you, ma'am. So as I observed, during when the patient will do the point each fingers on the left and right side of the shoulders, so I closely attach of the and there is normal with this the same. So ask the patient to shrug his or her shoulders, to push his or her arms and out pull his or her arms in. So, ma'am, can you please shrug your shoulder, ma'am? Shrug, ma'am. Thank you, ma'am. Shrug. So, thank you, ma'am. So then I already observed that the stage of the assessment of strength of the is equal bilateral, which indicates a normal finding. So inspect and palpate both sides of the elbow and lateral and medial epicondyles. So before I proceed then I forget that one. So ma'am, can you please do this, ma'am? So fine, ma'am. Can you take this 2 seconds, ma'am? So, thank you, ma'am. So, assess the exact location of the pain, then presence of the numbers of tingling and tenderness. So ma'am, so can you please grab your elbow, ma'am? So I will inspect for any tenderness and burning assess. So as I observe, as I palpate the inspect of the elbow of the patients, I did not notice some tenderness as well as the pain, which is resulting some inflammations as tennis elbow, the lateral epicondylitis, then the golfer's elbow, the medial epicondylitis, then none of this is present in my present case. So then 15, so inspect the wrist for any tenderness, then tap on the patient's wrist, then the tinel sign. So, ma'am, can you, ma'am, for your wrist, ma'am? Okay. Your right hand, ma'am. So, then use the diagnosed carpal tunnel syndrome, the condition caused by comprehension of the nerve and your wrist of the symptoms can be include numbness. So ma'am, can you please do it? So as I observed, we all know that the presence of any tenderness, so numbness and the tingling, the sensation might be indicate the carpal tunnel, and the syndrome caused by median nerve running through the little tunnel formed by carpal bones. So what I observed during the inspection of the wrist of my patient, so I didn't see any presence of signs of the carpal tunnel syndrome, and that is normal in good po, ma'am. So 16, then ask the patient to push the dorsal surface of his or her hands together and hold the patient for 30 to 60 seconds. So for the parent sign, so ma'am, can you please do this, ma'am?
Is that a video?
Then note for any numbness or tingling sensation on the pain. So 30 seconds. 1, 2, 3, 4, 5, 6, 7. So thank you, ma'am. So as I observed, there is no presence of pain, numbness, or tingling sensation. So for the koan, for 17, so assess the strength of the wrist then and the elbow at the same time by making a fist of asking the patient to push outwards of the inward. So ma'am, can you please do this, ma'am? So pull, ma'am, pull. Dira ha, ma'am. Ginda ha, ma'am, dira. Push, ma'am. No, thank you. So assess the range of motion of the elbow by instructing the arm to flex. So then can you please ma'am, can do the 18 motion like this. There. Okay, ma'am. So then not for anything. So as I see, I don't see any pain. So as I noticed, there is no presence of pain and doing the procedure, and also the patient is handy and can do eating process. So palpate each joint of the fingers, then individually ask the patient to squeeze your hand, then palpate for skin warmth and joint swelling and tenderness. Ma'am, can you please open your fingers, ma'am? So can you please squeeze my hand? Okay, ma'am. Thank you, ma'am. So as I do the observation during palpation of each fingers, I did not locate any abnormalities such as pain, tenderness, and joint of swelling of the fingers. So for the performance phase of the lower body, so 20, in assessing the hip strength, use your hand to establish the patient's back. Then ask the patient to raise his or her leg one at a time. So to check how stable your pelvis is, which must be supported by your hip abductor and the external rotator muscles. So ma'am, can you position your legs like this, ma'am? So ma'am, Ma'am, can you please forward, ma'am? Yeah, can you slowly raise your legs, ma'am? Thank you, ma'am. So, yes. So, thank you, ma'am. Then, so, as I observed, the joint moves is there. There is not any reported pain or tenderness. So, in the patient case, so muscle strength are equal, bilateral, and the patient able to fully raise then opposing force. So, as you can see during the assessments. So, 21. Ask the patient to lie down, hold the patient ankle with dominant hand, and hold the patient's knee on the dominant hand, and instruct the pull the knee up and push. So, ma'am, can you please, ma'am, lie down, ma'am. Push. Push, ma'am. Okay, ma'am. So as I observed, so the rotation of the knee is normal from pushing downward to upward, and I don't see any pain and dislocating joints, and also the tenderness from the patient. So I didn't see any discomfort of the patient or any pain. So palpate above the elbow and patella and press down, and the patella and palpate also the joint line, and starting at the back, moving around the front of the patella. So ma'am, can you please sit na, ma'am? So palpation for the patella. So so 23, press the patella. So then 24, then grabs the patient, the ankle, pull the patient forward and backward. So the Leachman test. So to ensure the proper lining of the joint and patella by pressing if there the presence of any dislocation or joint. So as I observed, so that during my palpation, then starting from the back, moving around the front of the patella, so I don't feel any dislocation and improper alignment of the joint. So 25, so ask the patient to extend the knees and bring the knees back in the while putting one hand top or the knees and the other hand on the feet and assess for strength. So kani ma'am kanang mora siya gihapon siyang proseso, ma'am, pero mag-assess na po mo sa imong strength, ma'am. So can you please ma'am? Pull, ma'am. Then push, ma'am. And pull. So, tigas, ma'am. So in according to assess the strength by knees and putting of the one hand in the top of the knee and other hand piece is there is any presence of kanang force but during pushing. So as I observed during the so wala ko nakita nga kanang pag forward sa knee, then so ay kanang ko sa kong galingon nga na siya force box, so na siya kusog. So for the 26, so palpate the Achilles tendon to the front of the anterior portion of the ankle. So to palpate the muscle support and anterior part of the ankle, which is the Achilles tendon, and to see if there is a presence of any dislocation. So, hi ma'am, so can you please ma'am, the proper position of your feet, ma'am? So, right side, ma'am. So, according to my observation during the palpation, there is no problem at all then from the anterior portion of the ankles of my patient. So, 27, so ask the patient to pull up against the tooth and instruct the patient to roll feet around. So, to see there is the presence or problem the patient push during rotation and execution, and to see also the proper movement of the tooth. So, ma'am, can you please, ma'am, do this, ma'am, oh. Kana ma'am, say, paubos, ma'am. Then tuyok, ma'am. So, because ma'am. Then above ma'am. Ito. So, okay ma'am. So, as I observed during the rotating the pulse of my patient is that she performed well and there is no presence of pain and discomfort. So, for the others, so wash hands, then remove the gloves. Wash hands. Then inform the patient. So ma'am, so as I observed ma'am, so I don't see any abnormalities ma'am on your joint ma'am. From your mandible ma'am to your clavicular line ma'am into your elbow, wrist, joint and toes ma'am. So I don't see any problem ma'am. So discrimination of findings or identification. So, ma'am, hi ma'am again, ma'am. So, according to the assessment, ma'am, or during our performing the assessment of skeletal and skeletal strength, ma'am, musculoskeletal assessment, ma'am. So, I don't see any problem, ma'am, but I will send it, the result to the attending physician, ma'am, for the final result, ma'am. So, thank you for your cooperation, ma'am. So, I hope you will be okay, ma'am. So, thank you again, ma'am. So, that's all. Thank you.